Excellent. Well, we are again with Dr. Sara Meng. I do have Shane on line 3. Shane, good evening.
How you doing?
I'm doing good. How are you?
Not too bad. I have a question for the dentist.
Okay.
I have 2 impacted wisdom teeth, and I went to a dentist here in Wichita, and he wanted to pull them, but he said that the root has grown into a nerve in my jaw, and the chance of pulling them could make my tongue go numb, and I wouldn't have taste in my mouth anymore. And I was wondering what kind of chances that would be. You know, he really couldn't give me an answer, and I just don't want to jeopardize something that major. They've been impacted for about 3 years, and they're not bothering me, but I mean, I'd like to get them removed, but I don't want to jeopardize my, my health by doing it.
Was this an oral surgeon or a general dentist?
I was just a general dentist.
Okay. Well, I would talk to him more about it and ask him those questions, because without seeing your x-rays and knowing exactly the position of the teeth, I can't say for sure. I can't give you any odds. He would be better equipped to do that. If you're very concerned about it and you want to talk to him about a consult with an oral surgeon, if he's not comfortable taking them out and you feel the risks are too great, you can discuss that with him. One situation that does come to mind that would make me think he might want these taken out is that we don't get any healthier as we get older. It's just a fact of life. You're probably young and healthy now, and he feels like it's a good time to take care of the problem so it doesn't cause you problems down the road. Also, there may be a situation where these teeth are causing problems with the molars in front of them. You may not be feeling any pain at this time, but he's trying to head off a problem that could cause periodontal disease on the tooth in front of it. So I would visit with your dentist, because he has your x-rays, and ask him some more questions. I'm sure he'd be glad to talk to you about it and, allay your fears or help you make a very informed decision for your particular case.
Right. Okay, well, that pretty much clears it up for me then.
Well, thank you.
All right, thank you.
He mentioned something about wisdom teeth, and this is very common. I mean, wisdom teeth, eventually they're going to be extracted. If not today, tomorrow. Why we have wisdom teeth?
That's a very good question. A lot of research has gone into it, and my feeling is that, our diets used to be harder, stronger. We're not using them as much as we used to. Our jaws are not as big as they used to be for some reason. So I think that it's just mainly, it's like an appendix. It's something.
So physically, with the shape, we are changing physically?
I think so. I think that the wisdom teeth, we're not sure why we have an appendix, and the appendix used to be useful, but now at this point, we don't really have a good use for it. And I think the wisdom teeth are along those lines. They're something that maybe used to be useful, but not at this point for most people.
So they grow sometimes like way in the back.
Right.
They end up hurting the bottom gum area as well.
Right. What happens in a lot of cases is that there just isn't enough room in the jaw for the wisdom tooth, so it's either too difficult to clean and decays, or it can't come into a proper position at all. And in that case, like Shane's impacted wisdom teeth, it's usually best to remove them because they can form cysts in the jaw. They can also cause periodontal problems with the tooth in front of it, which is an important biting tooth. So those are some of the reasons that we will recommend that wisdom teeth be removed.
We've been seeing that braces nowadays are becoming very, very common.
Yes.
I mean, you even see men and women ages 50s and 60s, but they have now braces. Although they are very expensive. I mean, $4,000 to $5,000 per
and
set.
Sometimes less.
Well,
sometimes less. It depends on the case. I'm not an orthodontist, and I don't do orthodontics in my practice, but I know that there are usually very inexpensive consults. They want to make sure that you have for most cases, they want to make sure that you have most of your adult teeth already erupted, so they don't usually see children until they've got their teeth in, except in some cases where the jaws don't match up, where maybe the upper jaw is too small or the lower jaw is too large. Things of that nature they may see a little earlier. They also want to make sure that you're cleaning the teeth well. So those are some things that we want to make sure that we've taken care of dental disease in the mouth, like decay or periodontal disease. And then an orthodontic consult will let you know what your particular needs are, and they can also tell you what their treatment plan recommendations are and what that would cost.
Why we have this spacing in the first place? Some people don't. Some people have spacing.
It just depends on the size of the jaw and the size of the teeth. If they match up perfectly, then you have very well-aligned teeth, and there are people out there, believe it or not, who are born with teeth that come into the right position and come into a nice smile, nice bite.
So it's not something that runs in the family.
With no crowding or no spacing. And then there are other people where, you know, we have all these people, maybe mom had big teeth and dad had small jaw. And then you have a child and you have a child with a small jaw and big teeth.
Right.
So they end up having crowding issues.
Talking about baby teeth, why we have to lose teeth? I mean, baby teeth are what, up to what, 20 teeth?
Yes, there's 20 baby teeth.
By the age of 6, maybe 7?
Actually, by the age of 2 or 3, we have all of our baby teeth.
We start losing them. I mean, by the age of
by 6 or 7, we start to lose them.
Why we tend to lose these teeth?
Those teeth are called deciduous teeth, and much like a deciduous tree, they're lost in order to make room for something new coming. So our jaws grow. As we're children, we grow tremendous amounts.
So we lose all the teeth, the 20, all of them?
We lose all 20 baby teeth because those teeth are there to help us eat, but also to hold the space for the incoming grown-up teeth.
So now,
early in the back, we will put in what is called a space maintainer to hold that space for the grown-up tooth.
Why sometimes we see the eye teeth, sometimes we have like double, sometimes like there's even 2 from inside. What is the causes?
The cause of that is sometimes the grown-up tooth is coming in, but it has not resorbed the root of the baby tooth. Baby teeth have very short, small roots that are easily resorbed by the tooth growing in behind it. So it comes in, and that root goes away. And then that's when you see it fall out, and the tooth comes down into its place. If everything goes well, that's the way it works. But sometimes, because of the growth pattern or another tooth position, or just because that's the way it is, the grown-up tooth will miss the root and come in and not resorb it. So then that baby tooth is still there and holding into the gums.
Now they remove these surgically. They're doing a really good job. I've seen a lady myself. I mean, I was shocked to see how good her teeth looked. They removed them surgically.
And some of them, in grown-ups, if it goes that long, they have to. In children, normally it can be done with local anesthetic in a dental office. We do quite a few of those. The orthodontist will have a tooth they think is needing to come out for a certain point in the orthodontic treatment, and they'll send them to us, and we'll take it out.
We are with Dr. Sara Meng. Again, if you need free dentistry work, the Kansas Mission of Mercy, they are offering free dentistry. It's going to be at the Kansas Coliseum on January 27th and 28th, 6 a.m. to 5 p.m. And this is really an excellent mission, actually.
Very much.
Excellent mission.
It's a wonderful experience for the patients and the providers.
And just to share with you, just in 2005, which is this year in Salina, it was about 1,973 patients, 2,000 fillings, 3,300 extractions. Not that painful.
No.
It's not painful.
Done with kid gloves, lots of finesse, and lots of anesthetic.
Okay. 72 root canals, and that's a serious work here.
Yes.
It's all for free. It's amazing. 20 partial denture, 670 cleaning. So that's quite a bit more. About $1 million. That's of donated dental work by doctors like you.
Yes.
Are you going to be there?
Yes.
Excellent.
Yes.
Again, we're with Dr. Sara Meng. What about brushing with baking soda? It works.
Yes.
I tried it. By the way, I tried it. It works.
Brushing with baking soda is been done for years. Before toothpaste came out, it was a very common brushing tool. And it has an abrasive in it. And it also forms some bubbles and gives you a little bit of a effervescence.
How often is once every 3-4 weeks, right?
Well, and maybe once or twice a week even. It depends on the person. It very much depends on the person. If it's causing you sensitivity or recession, you're doing it too much.
It makes the teeth white. Believe me, they do.
Yeah, it
Free.
does. It does work
Almost
for
for
some
free.
people, not everyone.
You know, my wife bought this soda, baking soda toothpaste.
Yes.
It's not as good as the powder baking soda. I've tried both.
But it does probably, the difference is that the toothpaste over the counter, the baking soda toothpaste, has fluoride in it. And so that's an added benefit you're not getting with just straight baking soda.
What about smoking and teeth? We're talking about here the darkness of the teeth, the tanning of the teeth, the yellowish color of the teeth, and nicotine and all that stuff, in addition to cancer maybe and some other diseases into the mouth. Can you talk about it?
Yes, smoking is